previous videos, I described in some detail how an HIV viral particle gets inside of a human cell and becomes part of its DNA. And from that process, we took these 4 lessons about how we might introduce innovations into existing human systems. But in global health and health innovation in general, we're interested not only in introducing something new to one system, but also hopefully spreading that new idea. Again, examples are breastfeeding, exclusive breastfeeding. So that may be something that you can introduce among one group of women, or maybe it becomes more part of a practice in one hospital. But we would like to see these innovations spread to other similar systems. So, as we know, HIV is very successful at spreading. So the last step is really, what can we learn from the way that HIV spreads from cell to cell throughout the body? So I will try to draw, yes, it always looks like a gingerbread man, a human body here. Here it is. And take what we just went through in terms of HIV infection of a single cell and learn how it spreads to other cells, other similar systems throughout the body. So first, we need to focus a little bit on an existing network inside of the human body. This is meant to represent the lymphatic system, which is a system of vessels through which immune cells travel all throughout the body to conduct surveillance and fight off infection. And we know that this lymphatic system has lymph nodes throughout. And these are the things you feel in your neck whenever you have certain kinds of infections. They spread, they swell, which is because you have immune cells that are very active there that are fighting off that infection. So HIV, human immunodeficiency virus, infects human immune cells. The process that I described to you involves virus infection of a single immune cell, and as we know, HIV infection has different modes of transmission. It can be sexual transmission, mother to child, or through needles or other blood-borne transmission. So HIV goes through the steps I described before in an individual cell, and then the immune system recognizes this foreign invader and starts to become activated, starts to bring in additional immune cells to the site of infection. HIV exploits that process, uses the fact that the system is activated and that more cells are coming to hijack and infect additional cells, going through these same steps in those cells, and spread throughout the body. So our learning here is that HIV spreads effectively using existing networks. It uses this existing lymphatic system to spread. And in point of fact, in our studies of health innovations that have spread successfully, we find that this is a very common feature, that a new innovation that's introduced into a system and become part of that system spreads to other similar systems on existing networks. So in the example that I cited about a better, quicker treatment process for patients with a certain kind of heart attack, that process, those steps that reduced treatment times to 90 minutes or less were conveyed in various conferences from person to person in existing networks, and more hospitals took up that innovation and made it part of what they do to reduce treatment times and time to treatment and improve outcomes for patients with a certain type of heart attack. So that's our last lesson that we can take from this biological model of efficient spread. So let me just go through and summarize what we think we can learn from really taking the term going viral fairly seriously. We know that HIV binds to a pre-existing receptor on a cell. So that is, the cell is the existing system. The HIV virus particle is the new innovation. It's brought in by a pre-existing boundary spanner. Then the virus makes its message accessible. It changes its RNA into DNA. DNA is the language that the cell speaks, if you will. The virus has evolved to take up that process. I don't want to say knows that because the virus doesn't think. But it makes its message something that the cell can use. And it also is incredibly adaptable. This flexibility, mutability of HIV is part of what's made it so hard to block. But as a model of efficient spread, that's a learning for us as we think about introducing a new health innovation into a system. It overcomes resistance. Cells have evolved to maintain the status quo. The virus has evolved to overcome mechanisms of maintaining the status quo so it can continue in the process of bringing in total change and something totally new to this existing system. Then it integrates into the DNA. That means it becomes part of what the cell does, and it's no longer new. This is just part of this system forever. And then, as I described in this video, it spreads on existing networks to other similar systems going through the same process over and over. So when we have something new, a new vaccine, maybe a more, for example, Depo-Provera is another one we've studied. It's a long-acting birth control. Breastfeeding, exclusive breastfeeding, reduced time to treatment for patients with a certain kind of heart attack. Lots of different kinds of health innovations that we want to bring in, something totally new into an existing health system. We think that we can learn from a virus that has evolved to be very, very good at spreading, to help us introduce change that could actually save people's lives. Thank you.